Thank you very much. It's an honor to be here. Please, thank you. Thank you very, very much. We have an unwritten rule back in Delaware. If an audience stands more than 15 minutes on a hard surface, you lose them all. I've already lost you before I speak. It really is an honor to be here. And Susie, I don't know, man. The Buffett family's been an incredible family, all that they've done in so many spheres. But I tell you what, I'm in love with that woman I'm sitting next to. If Fritz, as I'm told he was referred to, if he were here, I would look at him and tell him we have something in common. We both married way up. It's Dr. Gold and Dr. DeBanke and Dr. Cowan. It's an honor to be here. The truth of the matter is that I feel, Madam Mayor, that I kind of I'm not sure I can fulfill what I feel in my heart about the commitment all of you have made to deal with this dreaded disease. 19 million people will contract cancer around the world this year. And if we don't make significant progress, the next 5 years will be 25 million people. 25 million people. I'll bet you almost every one of you in this audience has been touched by cancer. Either you personally, a family member, a husband, wife, a child, somebody you love, somebody close to you. And cancer is, in a sense, a communal disease. There's no one family member that contracts the disease that the whole family member, the entire family doesn't feel the consequences. And so that's why I think what you're doing here is so, so important. And the community, I've known Omaha since the days of when I was first out here. I was telling the mayor with Eddie Zarinsky in 1974. And the thing about this community, it is a community. And the way you put this together with the significant philanthropy of several people, led by Pamela, but so many others, it's really a credit to the community. And now, I'm a Democrat, the mayor's a Republican, but I love her. You know why? You know why? She's a nurse before this. And if there are any angels in heaven, I mean this sincerely. I've been saying this. I've unfortunately been a significant consumer of health care. I lost my wife and daughter in an automobile accident. My 2 sons were hospitalized for a long, long time, not expected to survive. I spent 7 months in the hospital with 2 cranial aneurysms and an embolism. My son, Bo, was a year in intensive care, not literally intense, but under extreme care with cancer. And doctors allow you to live, but nurses let you, they make you want to live. Because the one thing, as you all know who've been served, is that I used to get a kick out of it. I was in ICU for a couple months, and my neurosurgeons come in and they'd tell the nurse, do this, that, and the other thing. And the nurse would go, yes, doctor, yes, doctor. Walk out and they'd do exactly what the hell they thought needed to be done, which was to make you comfortable. And the thing about nurses, and I mean this sincerely, Mayor, my son Bo was treated at MD Anderson. They were wonderful there, and at Jefferson Hospital in Philadelphia, as well as at Walter Reed. And over 11 of his nurses came to his funeral, and they waited in line 6 hours. 6 hours to make it into the reception or the funeral. And so I can't say enough about those of you out there who are nurses. Thank you, thank you, thank you, thank you. As we say in the Senate, excuse the reference to personal privilege here. It means a great deal to me to be here to celebrate the opening of this remarkable facility, and to recognize the Buffett family's commitment. It's an incredible commitment that's been made to this terrible, god-awful disease. It's probably the most frightening word in the English language when a doctor uses the C word. I can think of nothing that that strikes fear into people's hearts more than that. But Pamela and Susie and the whole family decided that this is going to end long before 2065. In addition to the state-of-the-art research facility and the brilliant researchers and clinicians who are going to occupy these halls and do occupy them, you're obviously a completely patient-oriented center just by the physical design of this place. And I hope that it means that many, many patients who will get treated here will get well in this place. And I hope other institutions follow your lead in terms of and more are, in terms of patient-oriented treatment. Like Pamela, I'm sure it's true for many of you. Your involvement in this fight is personal. The fact is that were it not for my son's diagnosis when he got home from Iraq, although I thought I knew a fair amount about cancer, whenever there's someone you love and adore has a serious problem, whatever it is, you try to find out everything you possibly can about that problem they're facing. And I had access as vice president and at Anderson to some of the most talented doctors and nurses and professionals in the world. And I got to learn from them. And above all else, what I learned was that there was hope. There was hope. Not for my son, who was diagnosed with stage 4 glioblastoma of the brain, but for someone else's son, for your son, your daughter, your husband, your wife. And that's because science and technology has reached an inflection point thanks to the brilliant research that's been conducted around the world, the scientists and clinicians who understand more about the disease now than they ever did. I learned that just 5 years before my son was diagnosed, immunotherapy was viewed as sort of something out there in the wilderness. I mean, not a joke, not a joke. There was very little collaboration among disparate disciplines, which everybody now recognizes. Now, routinely, oncologists are routinely working with immunotherapists, virologists, geneticists, chemical and biological engineers in ways that did not exist 6 years ago. I mean, it literally did not exist just 6 years ago. And that's what I mean by an inflection point. An inflection point. It's also because of the work you do here in reaching out to the broader community, especially the more rural areas that experts like you do in community practice all across the country. You know, it makes a difference where you contract a disease in this country. If you contract disease in the mountains of Utah or in Bemidji, Minnesota, or in some part in southern Delaware, you are much less likely to get the kind of treatment you need quickly and in time than if you do and you're within the shadow of a great cancer research facility. It's a reality, but you've reached out. The resources, prevention, early detection, treatment, you're bringing to each, and beyond the reach of most people, you've gone out and you've reached out into the community. The effect of this hospital already has been beyond the borders of the state of Nebraska. It's affected Iowa, it's affected other states, all the states around you. And it matters. It matters a whole lot. It was, in fact, that this inflection point provided a new reason for hope for me that drove me to want to get involved in a fight from the standpoint of this all came about almost as an accident. I walked out in the Rose Garden after my son had passed away to announce that I wasn't going to be seeking the nomination. And I said, it wasn't scripted, I said I have one regret about not being able to be the next president, because I would have liked to preside over the end of cancer as we know it. I think in the next 8 years, we're going to be in a situation where you're going to see cancer, the face of cancer, change more rapidly than it's ever changed in the history of fighting the disease. For decades, we thought we could tackle cancer one discipline at a time. But that's not how cancer operates. Cancer uses every single tool at its disposal. It hides in the immune system. It builds its own blood supply. It uses viruses to spread. It engineers a friendly cellular environment to support its survival and its growth. And it knows how to spread through the body using pathways and mutations that we don't fully understand even to this day. Cancer never gives up. Cancer never surrenders. That's why we have to use every discipline that cancer does. And we're starting to do it, unlike any time in our history. 6 years ago, oncologists weren't routinely working with immunologists, as I said, or virologists, or geneticists, or chemical and biological engineers, but they're doing it now. And I must tell you, you've been focused on an enormous possibility that comes from aggregating and sharing millions of patients' data like genomics, family history, lifestyles, treatment outcomes, by using this supercomputing capacity that didn't exist even 6 years ago. You know, we can do 1,000,000 billion, hear me now, 1,000,000 billion calculations per second, allowing us to uncover why therapies or treatment works for one person and not another if we have enough data aggregated to look at the patterns. It's like reading the stars. As I said, on so many levels, we've reached an inflection point of science and technology. But the Cancer Moonshot was about more than research developments. It was about, my intention was to bring the best knowledge and tools we have to all the communities across the United States, about making sure that prevention and early detection reach every neighborhood, which they do not do now in equal measure. It was about reducing disparities in care that still exist today. It was about putting patients at the center of our solutions, at the center of their care. Doctors I could name who I know you know well at Anderson, one of them said to me, you know, Joe, I think we're going to look back 20 years from now and realize how barbaric we had been the previous 40 years in treating of cancer. Not intentionally, without knowing. Only 3 things happen. You detect, you go in and get the best surgeon you possibly can to excise the cancer, and you use radiation and chemotherapy that in many cases do more harm than they do good. They kill the good guys, not just the bad guys. And so we're in a different world now. I know that's what you're all about as well. So I'm thrilled to be here today to talk about some of the progress we made and where I believe, presumptuously, dealing with a lot of great doctors like your docs here, that where I think we should be going. At the outset, as I said, when we set up the Cancer Moonshot, was to fundamentally focus on 2 things. Injecting a sense of the urgency of now in this fight, to double the rate of progress, to do in the next 5 years what would ordinarily take 10 years. It's totally within our capacity to do that. And 2, changing the culture, coming up with new strategies for the fight against cancer, the 2017 fight against cancer and beyond. Not the one that was set out by Richard Nixon in 1971 and declared the war on cancer. He meant well, but he had no army. He had no tools. The model used then was Dr. DeBakey, finding the one single cure for polio, finding the one single cure. There was no ability to share. Hospitals not only didn't try to share, they didn't even have any ability to share data information. There's 204 totally different cancers that exist. Everything's changed in 46 years. We've aggregated so much information. But we still operate under an institutional structure that existed in 1971. It doesn't work in the year 2017. I was stunned to find out things that weren't happening in the way in which research money was granted or in the way information wasn't shared. Look, so we have to update our strategy to the 21st century, which you're doing right here in this hospital, to be more interconnected than we ever have imagined. I hope that the Fred and Pamela Buffett Center will be the forefront of that change. With enthusiastic support from federal agencies, the Cancer the Cancer Moonshot Task Force, we entered a different era. I said 2 things to the president when he asked me to set this up. I was going to look at every single federal agency, and I went to every major cancer center in the United States of America and around the world over a year period. I met with over 14,000 oncologists, and what I found out was that there was a lot of data that never got shared. And so what happened was that we went out and found out that, you know, in Citizens of All Stripes, we launched 80 new actions and collaborations designed to change the way we do things in the cancer delivery system and results for patients. And so these actions flowed from this task force. There were all the federal agencies, and they were the task force. And there was a blue ribbon panel we put together of the leading experts in the country. And let me explain very quickly. The task force, we engaged all the federal agencies, all the government agencies you'd expect to have anything to do with cancer. And they included the National Institute of Health, as you'd expect, the National Cancer Institute, Department of Veterans Affairs. But I brought in other outfits like NASA and the Department of Energy and the Patent and Trademark Office. Why NASA? NASA's forgotten more about radiation than anyone in the cancer research area understands. NASA. All of a sudden, people, what the hell's NASA doing? They haven't been doing any of this. We brought in DOD. Why? They're going to be able to do a billion calculations per second within the next 4 years. And the Blue Ribbon panel included 30 experts who engaged hundreds of other researchers and doctors and patient advocates and others who, with the goal of prioritizing the areas in which we should first invest. There's many areas. What should be the priorities? My dad used to have an expression. I'd say, but I thought, Dad, and he said, look, Joey, if everything's equally important to you, nothing's important to you. Where can you get the biggest bang for the buck to save the most lives the quickest? That's what the Blue Ribbon panel did. And so I think we made a great deal of progress. One, because we brought agency leadership together. The Department of Veterans Affairs, for example, the largest hospital in the world, and the Department of Energy. They set up a completely separate line where now the VA transferred $4 million bucks of the Department of Energy to generate a dedicated line so that all the VA cancer data can be accessed immediately in one spot by those Department of Defense Department of Energy computers. Find new things that will allow patients to make progress and how to treat those patients. You know, in addition to that, we launched the National Cancer Institute Data Commons and the Genomic Data Commons. There was this thing that was at the National Cancer Institute that had about 18,000 samples of patients that were located in one spot, the Cancer Genome Atlas, they called it. Everybody knows the aggregation of data can help. Well, we put that in one, we made that public. It had 14,000 patients. Now it's over 30,000 patients. I was able to work out agreements with 9 other nations, from Australia to Japan to China. Now all this data is flowing in. And so what we have now is we have people, and it all had to be made public. It all had to be made accessible to any researcher in the world who wanted it. And guess what? Amazon Cloud said, we'll give you all the space in the cloud with no cost to be able to store all this data, to generate this. And just since we set that up, already it's been tapped 80 million times. 80 million times researchers have tapped into this data that they didn't have access to before. No way to get that access before. This data 80 million times, increasing the chances exponentially that answers are likely to be found. And the 30 experts of the Blue Ribbon panel made recommendations as to how to make major challenges in cancer research and prioritize what we should be focusing on first. Challenges which held the highest near-term potential to have the greatest impact on patients. I'll give you an example. First, they said we should set up a national program to identify individuals with Lynch syndrome. Lynch syndrome causes colorectal cancer and other cancers for people as early as their teens and 20s and 30s. But there's a way you can measure whether or not you have Lynch syndrome. If you do have Lynch syndrome, you can likely live your whole life fully, because instead of waiting until you're 45 for your first colonoscopy, you get one when you're 19. or 18, it can have a phenomenal impact on the number of people who don't die from cancer. We launched a 3D Cancer Atlas. The 3D Cancer Atlas is a web-based catalog that will allow doctors to map the evolution of tumors and use predictive models for tumor progression and treatment responses to make informed decisions at the front end. This is all within our wheelhouse. It's all within our capacity to do so, but it's never been aggregated before. There's a renewed momentum, and there's a whole lot of renewed hope. Apart from what we did at the White House, there's real excitement around the country about the moonshot, because we started a program in the White House. I believe it has become a movement. It's well beyond the White House. It's well beyond the government. More than 80 organizations and companies formed new partnerships and announced new commitments to find new ways to detect and track cancer using blood draws. And I'm not going to don't have time to go into it, but all the docs here know the incredible possibility that holds. A lot of cancers take up to 14, 16 years to develop. If you can detect that cancer gene in your blood cell, then you're in a position to be able to take early preventative action. We reach inner city communities with prevention strategies and detection technologies to share data across laboratories, across cancer centers, across international borders, so we can make progress faster. You know, it's kind of amazing things that doctors have been wanting to do, but have been unable to do. These groups are coming together to collaborate in ways that they hadn't occurred before, more than they did a decade ago or even 5 years ago. 18 academic research centers are participating in the RNAi Global Initiative, to find new clues for human gene functions that are going to help us understand and defeat cancer. Look, we need to build on a movement that started in the moonshot, and my wife Jill and I have decided to do what a lot of you have decided to do here, is to devote a significant portion of your life to making sure that we change cancer in a fundamental way. I am not a doctor. I am not a scientist. I suffer from having been a lawyer and a vice president of the United States of America. But the only two things I know how to do relatively well is convene people and shame people. Not a joke, when they don't cooperate. I'll give you an example. I was asked to keynote the World Economic Forum at Davos, and they then asked me to put together a panel on cancer after the moonshot was announced in Davos, Switzerland. And there were 6 individuals who came and sat at that round table along with other 3 Nobel laureates, and it's a very prestigious group. And each of these groups explained to me how they were going to get as many copies of the GNA sequencing that were done by tens of thousands of people to give them the ability to access this information, et cetera, et cetera. And there were 6 individuals with very, very prestigious backgrounds, all spending somewhere in the range of $100 to $200 million to do this. And I asked them afterwards, I said, after we go back to Washington, can you come in my office and meet with me? And I will not name them because I don't want to embarrass anybody. I said I wouldn't be public about it, and I haven't been. They sat in my office with just me, no staff. And I said, can you explain to me what you're doing? And they all went ad seriatim, explain what they're doing. You'll understand this, Doc. And I said at the end, I said, it sounds like you're all doing the exact same thing. My word, here's the body language. You know I'm telling the truth. I said, let's take a coffee break. 4 of the 6 came up to me privately and said, keep the pressure on, Mr. Vice President. Will you keep pressure on? If I talk about aggregating this, we're going to have a real problem. But now they're working together, exponentially increasing the prospects. We'll make more progress. Look, you know, well, let me end. As I said from the beginning, for me and for Pamela and a lot of other people, this is a lifelong commitment. And with the encouragement of some of the leading experts, such as Eric Lander of the Broad Institute at MIT at Harvard, and David Agus, who heads up USC Lawrence E. Ellison Institute of Transformative Medicine, to Elizabeth Jaffe, international leader in the development of immune-based therapies at Johns Hopkins, to, in addition to CEOs of a number of biopharmaceutical companies and presidents of cancer centers, a total of 38 of these individuals, including 5 Nobel laureates, came to see me. And they asked whether or not, since the moonshot has not been picked up as a moonshot in the administration, would I start a thing called the Biden Cancer Initiative. And we will be announcing very shortly the board made up of all of these people, another 20 or so, and focus on changing the way we do business in cancer research and development and providing cancer care by breaking down the silos and increasing access to information. I thought long and hard about how I can continue in a small way to contribute to this fight. And I think I can do 2 things, I said. I think I can convene and encourage people to collaborate a little bit. That's what we did over the past few years in the moonshot. And frankly, that's the only thing I've had the capacity to do in my career as a practical matter. At the Biden Cancer Initiative, and it's not designed to compete with any other research operations, it's not it. It's about a convening mechanism to bring people together, bring all these incredible people together, these institutions together. We're going to convene experts and identify solutions on the biggest issues that surround the fight against cancer. And we're going to start by focusing on improving data standards and giving patients the mechanism to share their data. Those of you who have someone who's had cancer, you probably were shocked to find out if they passed, or even if they didn't, you had trouble getting their cancer genome. Who owns the cancer genome? You know, your hospitals don't share very well because it is something that, and patients don't know whether they can take the information they have and send it to another outfit or let it be aggregated in other studies. And so there's got to be some more education. The standard, data standards. I didn't know as a lawyer that there's no single standard for biopsies and preservation of biopsies. So hundreds of thousands of them are, you know, are rendered useless. There's a whole lot of standards of determining how medical records are read. You know, Barack and I felt very, very excited that we thought by putting over $30 billion in the Recovery Act because we were told the one thing we could do is electronic record keeping would revolutionize medicine. Well, what we did is 6 companies came in, each took $5 million, and they did a great job, but they're different silos. When my son had what was a study of one, he had, as I said, stage 4 glioblastoma. So what they did was they injected anti-PD-1, and then they injected a virus into his brain, an adenovirus, to try to get the T cells working. And so it required him to have a CAT scan twice a day to see what was happening in the brain. And all of a sudden I found out we were at a great hospital in Pennsylvania, because that's near where he lived, at Jefferson, and the doctors were at MD Anderson. There was no way to transfer the information. The 20th century. No way to transfer the information. It was needed in real time. So my son-in-law, who's a leading physician at Jefferson and is a leading surgeon, would go in with his iPhone, and he'd take a photograph. Not a joke. So, you know, there are not many standards by which when we did the human genome, everybody uses the exact same language. So, for example, one doc will say, well, it's a broken femur, the other docs say a broken leg. There's no way in which to be able to detect that by the transmission of electronic record keeping. So anyway, there's a call for greater transparency, continued work for the cultural change here that requires us to stay engaged in ways we haven't been before. As I said, because for the first time in 45 years, there's a real movement to double the rate of progress against cancer, and a real acknowledgement that collaboration is the key. We need to keep up this momentum that was initiated by the moonshot. And let me conclude by saying I am incredibly optimistic about what we're able to do. but only if we come together and break down these silos that exist out there now to best care for patients. You know, we need a sense of urgency that I've described to be infused into parts of the approach to defeat cancer, because it matters. One thing clinicians can tell you, all you docs out there, cancer clinicians can tell you, that every minute matters. How many times, Doc, has a patient said to you, Doc, I know I'm not going to live, but can you give me just 6 more weeks so I can walk her down the aisle, Doc? Just give me 6 more weeks. Doc, if I have 3 more months, I can put my finances in order so my family's going to be okay. Or Doc, my daughter's going to have her first child. Can you give me just a little more time? Just a little more time. This is about minutes. This is about days. This is about weeks. This is not about forever. And there's so much, just if we didn't make one single additional breakthrough, there's so much more we could do to give those extra days, weeks, months, just by additional access to information. You hear it all the time, these docs do, but I'm hopeful. I'm hopeful about the progress that we've made and the promise of what I think lies ahead. Mary, you talked about 2065. I see the day when this beautiful young girl takes her child or grandchild to get her physical, not a joke, and she gets vaccinated for measles and mumps. She also gets vaccinated against cancer. Specific types of cancers, like you can right now against one. Vaccinated against contracting the disease. That is within our wheelhouse. We can already do it now for one particular pernicious cancer. I see the day when those of you in this room are able to go into a doc and your medical treatment is so personalized because of their ability to read your entire genome and be able to understand how it affects or doesn't affect the growth of cancer, that you will be in a very different place. A very different place. I see the day when we'll be able to identify through blood markers cancers that haven't yet developed, or to catch cancer in its most treatable by identifying the early signals of cancer from blood biological fragments that shed from cancer cells. One thing I can tell you is we're getting close. These brilliant people behind me, they're getting closer and closer and closer. And there is real hope. If we did nothing more than break down the silos to prevent greater collaboration, we could extend life. That's what I see this center being about. That's what I've read about, Doc. That's what you want to do. I'll conclude by giving you one example. There is an organization made up of oncologists. It's 16,000 of them, and they're researchers. And I spoke to them in New Orleans, Louisiana 2 years ago. And I talked about you've got to change your attitude about sharing data. If you're an astrophysicist and you come to the federal government and NASA and say you want a grant to study the 7th ring of Saturn, you finish your study, you get $50 million to do it, you have to publish it immediately, put it on the web for the whole world to see. You come to me for a $50 million grant to study the proteins on cancer cells. You finish your study. You don't have to publish it for a year. You publish it behind a publication that can cost up to $180,000 a year to have access to. And if you fail, you don't. I found out, Doc, that 80% of the cancer studies never published. So because the president gave me the authority, carte blanche authority, I put in motion. If you don't have your study published within a year after you have finished the study, failed your success, you are personally fined $10,000 a day. Well, guess what? As they say in southern Delaware, a lot of folks haven't had an altar call. All of a sudden, this data is being shared because it makes a difference. If you're working on a particular study I'm making an application for the same study. You've done yours, it's failed, it hasn't worked. Then maybe you learned something from the failure as well as the success. So folks, look, the reason I'm excited about this hospital and this effort, this cancer center, is I don't think anybody here has to be convinced that sharing data is something that is in their interest. I'll give you one last example. You know how we broke the code on AIDS? There was no one silver bullet for AIDS. There's multiple therapies that are used, multiple drugs. And it's come considerably under control from a worldwide epidemic it was. But you know what? If your drug company A, your drug company B, and your drug company C, and I'm a brilliant young researcher, and I want to use each of your drugs, one of each of your drugs on a particular cancer that I'm working on because I think in combination it would work better, it takes me between 1 and 4 years to get that ability to get that sharing done. So we had a crazy idea. We said, why don't we come up with a drug formulary? When you go in and put money in a jukebox, what do? Do you have to have a separate licensing agreement with Beyonce or Barbara Streisand to hear a song? It's already been worked out. And so what do? We started off and we laid out what we would do at NIH. Now, ahead of time, and there's over 270 cancer drugs that the major companies are testing now. It's going to cost them millions of dollars to take it to fruition. But if they put them all on the table now, access for any researcher, we've already worked out the intellectual property rights that each of them have, what the value of each of those drugs is. So if they find an answer in combination, they make a lot of money, and they should make a lot of money. They should. So your drug is worth 30%, yours is worth 40%, mine's worth 30%. It's already worked out, just like a licensing agreement to play a song. There were only 2 drug companies initially. Now there's 14. Now there are tens of drugs being made available to researchers to study, and without having to go through hoops for 3 years. If only one breakthrough comes, could save a whole heck of a lot of lives. So this is all I'm trying to do is get greater collaboration, break down the silos, and have a 21st century institutional approach to how to deal with cancer. And I think we're well on our way to do that. And my guess is, right here at this center, you're going to be one of the leaders in the world in doing it. So thank you for what you're doing. Chancellor, doctors, thank you. All you philanthropists who made this possible, thank you. Because as my mother would say, God love her, you're doing God's work. God bless you all, and may God protect you.